Hi everyone, my name is Dr. Schreier and I'm with Capital Chiropractic. Today we're going to show you how to get a little bit more familiar with your foam roller. There are different kinds of foam rollers. We have these in our office and we also have these vibrating foam rollers in our office, which I'll show you how to use as well. So the area that we're going to focus on is the hips. Why do we need to work on foam rolling our hips? Well, because especially if we spend time sitting, maybe you're even really active, both of those populations, which almost accumulates everybody, those people, those individuals can develop hip tightness, knee tightness, even some low back pain can relieve by foam rolling these areas regularly. So I'll show you how to foam roll your IT band, which is also known as your iliotibial band, and also your posterior glute muscles or your posterior hip muscles back here, okay? So we'll start with your IT band. So the area that you're going to foam roll for your IT band is going to be just below your hip bone. You have your femoral head right here. No need to foam roll over that. So you're going to foam roll just below that to above your knee. Bottom leg straight, top leg bent. Top leg's going to be helping you drive the motion. This might be a little bit uncomfortable, but if it's uncomfortable, that means you should probably do it. Tension here can lead to hip pain, knee pain. Tissue buildup is not the best in this area. And I highly recommend doing that on both sides. If one side is more tight than the other, that's normal. So the other area, we're going to talk about your posterior hip muscles. Your piriformis is back there. Maybe you've heard that. So how we're going to do that, the cheek that you're going to be targeting is the one where the ankle is going to come up, be on top of the knee. It's the same sided arm that's going to be down on the floor. We're going to go ahead and roll this out. Oftentimes, people tell me that this feels really good. So I'm excited for you guys to try that out. Like I said, I was going to talk about that vibrating foam roller. We have this in the office. This is also called the Viper through the Hypervolt or Hyper Ice company. And I'll show you how to use it with my IT band. So we'll turn it on. And then we'll start turning on the vibrations. You might be able to hear it. So why would we need a vibrating foam roller? Well, foam rolling can sometimes be uncomfortable, and the vibrating sensation can make it feel a little bit less uncomfortable. It's also great for breaking up any adhesions that might be in that area. It feels good, and it can help with improving blood flow to help with healing. So if you have any questions about foam rolling your hips or other parts of your body, anyone here at the clinic is happy to help out. You can go ahead and make an appointment. I'm Dr. Schreier, and I'm signing off.